There's so much to know about Parkinson's disease, so where do you start? Well, the subject for today is what's next in Parkinson's disease, its treatment and strategies, and it's delivered by Petrossian, MD, and sponsored by the Parkinson's community of Los Angeles. The original presentation was 1 hour in length. You'll find the link to it in the YouTube description below. Parkinson's symptoms are caused by a lack of dopamine in the brain. The brain cells that produce the dopamine have since died. Instead, physicians prescribe levodopa, also known as L-Dopa, to help the brain produce its own dopamine. People who take levodopa may know it as Sinemet, that's its brand name, and Sinemet works for a period of maybe 3 to 4 hours, producing what are called on and off periods. 10 new medications for the control of motor symptoms have been produced since 2014. Here you'll see a chart including some of them, such as amantadine and Ambrosia, a rescue inhaler. How does a neurologist evaluate your motor symptoms? An old school way is to use the old Hauser diary, in which the patient would record their symptoms every 30 minutes. A much more reliable way has come about with technology. Things such as the Parkinson kinetograph by Global Kinetics. It evaluates tremors and reports it out through an app. Bradykinesia and dyskinesia. Red lines indicate when the patient is supposed to take meds, and it's wearable. The Strive app by Rune Labs is used on an Apple Watch. It reports tremor and dyskinesia, but not bradykinesia. It may feel less medical to people, and it has the advantage of reporting other medical information as well. However, note, technology is always evolving, and the two platforms will likely see more competitors. Deep brain stimulation, often referred to as DBS, was first used to treat Parkinson tremors back in 1997. It continues to evolve like so much in technology. In 2002, it was approved to treat advanced Parkinson symptoms, and in 2016 for the earlier stages of PD. DBS acts like a pacemaker for the brain, helping to control motor symptoms such as tremor, bradykinesia, off times, and dyskinesias. Major players right now are Medtronic, St. Jude/Abbott, and Boston Scientific. The competition means that the systems get better and better as the years progress. Software has evolved just as the hardware has evolved in the use of DBS. For example, Medtronic's BrainSense charts the on and off periods and how it coordinates with the therapy being delivered. It allows the neurologist to better adjust the therapy for the patient. One thing is certain, DBS will continue to evolve. One very promising new technology that competes with DBS, so to speak, is focused ultrasound. It's non-surgical. It uses high-intensity ultrasound, which is guided by an MRI, which is a new advancement. It's now been FDA approved for tremor-predominant Parkinson's disease. You may be interested in exploring this as an option. Like a good neurologist, Dr. Petrossian brings us back to what we can do for ourselves now. The long-term effects of exercise in early Parkinson's disease are really phenomenal. Regular physical activity results in a slower deterioration of postural and gait stability, so you're more stable, activities of daily living such as getting dressed, and processing speed. That's your mental speed of activity. It takes time to develop a new technology or a new drug. It has to go through a period of rigorous testing. Part of that process is called a clinical trial. If you're interested in learning more about what's on the horizon for us and being tested now, I recommend that you go to Dr. Petrossian's original video. Again, the link is in the YouTube description below. Dr. Petrossian concludes with new definitions of health. Positive health is the ability to adapt and to self-manage, especially in the face of social, physical, and emotional challenges. One thing she points out is Bas Bloem, the famous Dutch neurologist, and his Silver Linings Questionnaire. If you want to find out more, check out the original presentation. You'll see the information in the YouTube link below. We hope you have enjoyed this presentation, and we hope you check out the original.